My name's Shaun Kelly. I'm the head of clinical services at Premier Clinic. We're based as a multidisciplined clinic. We're based in Blackburn, in Lancashire. It was quite a long process. We'd looked at laser, we'd read around about the research. The timing when we first looked at it wasn't right for the clinic, but as we expanded and became much more busier, we started to look at the relevant treatment modalities of the laser, shockwave, and other things. And we approached Celtic, and we purchased the small MLS Laser machine, and it's been an excellent purchase. It's, from a clinical point of view, it is really effective with various conditions, whether it be from a podiatrist side, an MSK side, or an injury rehabilitation side. So it does get used very effectively and continuously. Within the clinic, because we're multidisciplined, I would say the only people who don't use the laser are the audiologists and the GP. The rest of the team, the rehab team, the MSK team, the podiatry team, they use the laser quite often. It is used daily, and it depends on the caseload and what conditions they're looking at. Obviously, there are conditions that we're not going to use it on. But majority of patients will either end up having some laser therapy for their specific injuries or conditions such as plantar fascia, Achilles tendinopathy, osteoarthritis of the knee, hip, low back, various aspects. If they don't use the laser, dependent on the assessment, it may be the staff will use the shockwave initially over a couple of sessions, but then revert to laser for reducing the inflammatory responses. And we're finding that patients are very pleased with outcomes. It assists in treatment and speeds up recovery with certain conditions. But we're not reliant on the machines. They are part of the treatment modality. Using the laser on patients as a treatment modality depends on the assessment. An example would be we have a young lady who has struggled with her Achilles for a number of years, and has had previous treatment from us, and we've managed her very well. Recently, she's had to have further surgery, and she's now booked in for some further treatment. Mobility-wise, we use anti-gravity, Alter-G treadmill, but we wouldn't use shockwave on her treatment at the moment. That wouldn't be the way we would go. We would use the laser to bring down the inflammation and the swelling and enhance wound healing, so she's more comfortable. And we tend to work on it with cases like that on a 3-2-1 basis. We'll see them 3 times in the first week, twice in the second week, and then once the third week. And then it's a reassessment and see which direction we're going for rehabilitation or further treatment. Depending on what's wrong with them, you know. Yeah. We don't do 3-2-1 with everything. No. It may be that we do it once a week, but they're having deep tissue work in between. Of course. Yeah. Or they're having it in conjunction with deep tissue work on rehabilitation. Brilliant. You know, we've just after 6 months, we've just discharged a girl who had a degloving of her left leg in a road accident. She's got drop foot. She's had various skin grafts. And we've done laser towards the end of the healing process, because she was still weeping a little bit.
Okay.
And that's helped. It's
Yeah.
helped her.
Yeah.
Another patient is kidney failure. He's waiting for a kidney transplant. He has vascular issues and gets lots of discomfort in the lumbar region. And laser tends to ease that down for him, and it makes it more manageable for his mobility aspects, because his mobility is impaired and has been for a long time. So using the method of 3-2-1, yes, we do with some cases where we want to sort of like batter it in the early stages to get as much inflammation down, and then we can start on a rehabilitation program. Other times it may be once a week, or it may be over a period of 2 or 3 sessions over a couple of weeks. But that's in conjunction with the treatment modalities. Elite runner potentially could be chosen for the next Olympics. I was struggling with some Achilles tendonitis. Came on over about a 10-day period. I'd been to another clinic somewhere and was informed that it was growing pains. Parents weren't really happy with that. We brought her in, we assessed her, we arranged an ultrasound scan, and it confirmed the diagnosis. Biomechanically, she was assessed. Nothing untoward at that point. So there was no orthotic management or anything like that. We started her on a course of laser therapy, and that was one of the cases where we did do the 3-2-1 process. That reduced her symptoms by 50% in the first week. In conjunction with the laser, we did some deep tissue work, stretching exercises, rehabilitation, and we got her running again in using the anti-gravity altered G machine. So we weren't loading the Achilles, but we were maintaining her running pattern and her exercise. Within 4 weeks, she was back to fully loading, no pain, and running as per normal. Oh, definitely. If you want to expand your practice and your knowledge base, then get involved with the MLS, learn how to use it, what conditions it can be used on. It doesn't take away your autonomous decision making or your clinical knowledge. It enhances it and just gives you a better option for treating these difficult cases that may be protracted with generalized treatment. It's an addition to your treatment. It doesn't take over your treatment. Using shockwave in conjunction with laser therapy is not to be taken as using shockwave and then following it up with laser therapy. What we tend to use shockwave in certain treatment modalities, we may use the shockwave over a week of 2 or 3 appointments and then revert to the laser at the end. Okay. Because shockwave and laser work slightly different. Whilst the outcomes can be similar, shockwave works different from what laser does. So to use them both or one after the other, it negates each modality. To any potential client that feels they may benefit from laser therapy, all we would say is give us a call. We'll have a chat. We'll talk you through things and see if that treatment is going to be beneficial for you. Laser can be used in lots of different ways. You do not have to be an elite athlete with an injury to get treatment at Premier Clinic. You can be the average person on the street. You've got a small injury, a minor injury, or a nagging injury. And we'll look at it and we'll advise you correctly on which is the best way forward for a treatment. Laser can also be used post-surgery. So if you've had any knee operations, hip, spine, foot, ankle, we can use laser as part of a treatment in your rehabilitative program, reducing pain levels, inflammation, and in some cases speeding up the healing process in conjunction with other treatments. So don't be frightened of asking. We welcome questions, and there is no such thing as a stupid question. There is only a stupid answer.